You're listening to Beyond Wellness Radio, bringing you the cutting edge in health, biohacking, and sports performance. Stay up to date and listen anywhere and anytime on your computer, tablet, or smartphone by subscribing on iTunes. Catch your host, Dr. Justin Marchegiani, as he answers your burning health questions as well as interviews from world-renowned guest experts. For more Beyond Wellness Radio, go to beyondwellnessradio.com.
Hey there, it's Dr. Justin Marchegiani. Welcome to Beyond Wellness Radio. Feel free and head over to beyondwellnessradio.com where you can access our full podcast transcriptions. While you're there, you can also sign up for our thyroid and female hormone video series. This series goes into the root cause of why your hormones are out of balance. While you're there, you can also schedule a functional medicine consult with Dr. Justin, myself, where we'll dig deeper into the root cause of your health challenges. Feel free and think of sharing this podcast with at least one person. This podcast grows by people sharing it. Sharing is caring. If you can think of one person that can benefit from this information, please feel free and share it. If you're enjoying the podcast, make sure you subscribe on iTunes. You can also click below the video or podcast where you'll see the iTunes review button and leave us a review. You can also sign up for the newsletter at beyondwellnessradio.com where you'll get updates before anyone else. Thank you so much and enjoy the show.
Evan Brand, it's Dr. J. What's going on, man?
How you doing?
Doing great. It's been a little while since we've chatted. I was out of town in the Boston area. I'm back in Austin here. It's a Labor Day weekend right now, so this probably will come out for another month, but that's where we're at in the schedule, and excited for our fall to be here soon enough.
Back in action.
That's it, man. How about you?
I'm doing great. We've had perfect weather for like the past week. I've been outside as much as possible, soaking up the sun rays, because in the next 4 to 6 weeks, we'll probably see some trees starting to turn colors here. So then we'll be freezing and complaining before you know it.
I know, right? Well, we talked about in the pre-show a little bit that we wanted to address some gluten issues. I mean, we've talked about gluten. We got a whole bunch of content on gluten. But we're going to try to look at it from a nuanced position here today.
Sure.
Well, off the bat, people know gluten is the main protein primarily found in wheat, barley, and rye. Anyone wants a little more intel, they can go look at my interview with Dr. Peter Osborne on that topic. But gluten, primary protein, wheat, barley, rye. And why does it matter? Because of the fact that there can be some inflammatory reactions that can occur in the body via the immune system. And then also one of the big catastrophic side effects is leaky gut. And when you have leaky gut, that can really exacerbate the immune system to start tagging and attacking proteins that were in the gut that now got into the bloodstream. And the immune system can basically have a case of mistaken identity, right? The APB goes off with the guy driving the black Honda Civic, so to speak, and then you're driving that Civic because it's a similar car, right? And you get pulled over. In other words, what's happening in your body is it's tagging this certain protein marker, whatever that tag is, X, Y, Z, A, B, C, and then it looks similar to the proteins, surface proteins on your thyroid. And then your thyroid gets attacked, or your brain, or your nervous tissue, your myelin, your gangliocyte tissue, your intrinsic factor. So then what happens is your body can start to mistakenly attack various things. So the key issue is we want to cut some of these things out. One, because they're inflammatory. One, they're nutrient poor. And the second one would be they are toxic, meaning there's a high amount of pesticides and chemicals, GMOs, and Roundup that are used on it. So people that are using it, especially if not from organic sources, they're going to have a high amount of toxicity.
Yep. Now, people in the health space, sometimes they'll have a little bit of a relaxed approach with gluten. I think Dr. Rodney Ford, I think he said it best when he came on my show. He likes to call it, instead of a gluten-free diet that he recommends for his patients, he calls it a gluten-zero diet, which honestly I think sounds better, because gluten-free just kind of sounds like, gluten-zero is like, it's very blunt and concise. Zero gluten is the amount that's best for you, even if you're not someone that is a celiac. You don't have to be a celiac. I'm not celiac. I feel like I would know if I was celiac by now. I'm not, but I still do not consume it as much as possible, close to 100% zero.
Yeah, in my clinic, I refer to it as a grain-free diet, because it's not just popcorn or this or that. It's going to be grain-free, 100%, no grains at all. Now, if I cheat, my life I cheat a little bit, it's going to be with high quality organic corn, or it's going to be with high quality, organic rice, things like that. But again, it's going to be few and far between. And the better I feel, though, the more I want to keep my diet dialed in, because I'm just addicted to performing at a certain level. So
I
that's kind
agree.
of my goal regarding that. Now, the cross reactivity is also there, where other sister or cousin grains, whether it's oat or whether it's rye or whether it's other type of gluten-free types of grains, even rice, can potentially cross-react. So your immune system can see those other proteins and think, well, hey, your cousin kind of looks like you, your brother kind of looks like you, and may mistake it as being gluten. So that can be a immune stressor on the body. So keeping all the grains out can be a really good starting point. Now, here's the problem. There are a lot of clinicians and people out there that say, well, you know what? If you don't feel bad when you have gluten, then you may be okay. That's kind of the adage or the thinking out there with a lot of people that may not react to it. And the problem with that is, it's like telling a diabetic, well, if you don't get diabetes after having a little bit of sugar one time, it's probably okay. Now, we know there's kind of this cumulative effect where having maybe a small amount of sugar once may not be a big deal, but over time, your blood sugar will start to spiral out of control and go higher and higher and higher as insulin resistance sets in. Now, looking at gluten issues, so we have celiac, that's like the pathological form of gluten sensitivity. And then we have the non-celiac gluten sensitivity, the NCGS. That's the, hey, you're not quite celiac, it's not quite pathological, but we know you're sensitive to it. That's where the person may have it and they may not have an instantaneous response. It may not happen right away, and it may take a while, and it may not even be connected to the gut, meaning you may not have the bloating, the diarrhea, the gas, the cramping. You may just have a little bit of brain fog or maybe a little bit of joint pain and never even connect the dots.
Exactly. Now, a lot of people, they have spent money, and a lot of practitioners out there recommending people get tested, food sensitivity testing to look for wheat or gluten sensitivity. Waste of money. You and I have covered this on several podcasts. Don't go and pay $400, $500, $600 to get told that you shouldn't eat gluten. Just cut it out for 60 days, cut out all of your grains for 60 days and see what changes, see what happens. And then if you're willing to add some back in, like you mentioned, Justin, the organic rice or the organic corn, and see if things change. Like for you, you got on me about corn. You're like, look, man, you need to get rid of all grains. Don't just go gluten-free. And my skin got better as soon as I pulled out the corn, as soon as I pulled
Yes.
out the rice. So for me, I have to be a little bit more strict. I'm trying to make sure that we give people takeaways and we're not just saying a bunch of stuff. Point is clear here. Don't waste the money on food sensitivity testing. The best test is yourself using patience and a journal. And if you react to blueberries, well, there you go. If you react to avocados, there you go. If you react to rice or potato, there you go. But wouldn't you agree that there could be some false positives where someone may test reactive to something, but they're not? Their immune system is just hyperstimulated from their previous historical diet. Is that possible?
Yeah, I mean, my issue is more with the false negatives, meaning they test for something, gluten, whether it's like a gliadin test,
Yeah.
and they test negative and they think, oh, now I got this false sense of security that I can go
Yeah.
eat gluten. That's really the issue. The false positive is going to be harder because your immune system is going to be hyper responsive. So if those antibodies are higher, it's going to be easier to see. My issue is maybe the immune system isn't at that responding level, and it's really is, but it's just not at that time. And then you basically take a snapshot when it's negative, but it's really an issue, because then typically people that are positive, they're going to go and do what? Cut the foods out. So
Right.
I'm not worried about someone cutting it out that may be able to handle it. I'm worried about someone adding it in because they think they can handle it based on a lab test.
So they got the green light for
They
sure.
get the green light. Exactly.
Right.
I'd rather have someone stop at that stop sign, even though they may not have to, than think it's a green light and go through it and get T-boned, right?
Yeah, that's well said.
Yeah, so that's kind of my mindset on that. Now, the big picture on top of that is there can be delayed reaction. So when we add foods back in our patient's diet, we do it every 3 to 4 days. It's kind of a very slow type of add-in, and we do a small amount in the beginning, and then we max up to about 3 to 4 days, and we look for any type of reaction, any kind of small reaction, whether it could be brain fog, joint pain, it could even be just skin issues. So it could be poor sleep. So we really want to look at the nuanced symptoms that may not even be a gut-based symptom. And also, I've had one patient said, screw it, I'm adding gluten back in. It took 2 weeks and they just felt absolutely terrible. Like it just came reeling in where he was literally incapacitated for days.
Oh, I've seen months in some
Yeah.
cases. Nobody that I've experienced month. I've had people say about a month that their wrist pain came back, but I've read sometimes 3, 4, 5, 6 months for somebody that's just like, I'm going to go off the rails. Screw it. I'm sick of this. I'm not really getting any better with keeping gluten out. I've maximized my potential, but then they don't realize they really haven't maximized their potential. They were at a good baseline and then they backtrack. So
Exactly.
Don't suffer. Now, people think, well, where does this nutrition advice come from anyway? I mean, a lot of the stuff that you and I talk about is inspired by some of the work from Weston A. Price and what he's done. And he traveled the world looking at tribal societies. And maybe some of these ancient tribal societies were doing grains, but if they were, it was going to be either a fermented or a soaked or a sprouted or a properly prepared grain. And yes, they could. So if you see people arguing on the internet about, oh, grains are good for you, here's why ancestors did eat them. Well, the grains are still relatively new. Now, there probably are some ancient wild rices. There's the einkorn, the original ancient
Yep.
grain, stuff like that.
Yep.
But at the same time, the world is a different place, meaning that there's more toxins and there's more things that people have to react to. So yeah, maybe 1,000 years ago, you could have tolerated something like some wheat and some grains. But now, if your toxic load is already so high, if you've had a history of a low-fat diet and your gallbladder is likely stagnant or not optimally functioning, or you have a lot of chronic stress, so your hydrochloric acid levels and your enzyme production is lower, you're not in the same world that those people were in that were eating those type of grains. So your response is going to be different. Just because somebody else did something before doesn't necessarily mean that it's good for you. We have to really look at the new variables. And so that's kind of what I think you and I do is we'd look at, okay, what is the modern world presenting with this person? You know, what are your biggest areas of stress? Oh, you're an executive in a high rise in LA. Okay, well, that level of stress is significantly more than what a hunter-gatherer would have had. So we really need to make sure that it's a low toxin, nutrient dense, anti-inflammatory diet that is based around your good fats, your good proteins, your veggies. Maybe they can do rice, but maybe it's once a week and it's a treat and then they're done and they're okay with it and they don't flare up.
Exactly. And now looking at it from my perspective, number one, we have to realize that negative effects may not happen overnight. It's nice to have that. It's nice to have the so-called canary in the coal mine. Anyone doesn't understand that analogy, it's basically old miners used to not be sensitive to carbon monoxide as fast until they were asleep, which means they were dead. But the canaries would literally be sensitive to it. So they would literally bring a canary in the coal mine, and the canary would literally drop dead, meaning we better get the heck out of this mine because the carbon monoxide is really high. So that's the canary in the coal mine is you get the instant feedback before it's too late. Now, some people it's delayed and it comes in ways they don't ever connect the dots to, and that's where it gets really hairy. Now, I hear lots of doctors out there, well, hey, pull gluten out for a bit, which I think is great. Almost all of my patients go on an autoimmune diet to start with because I can't tell you how many times something like nuts or eggs can cause a problem. And because they're such a common staple in a paleo diet, anyone that has gut issues or severe neurological stuff or mood stuff or hormone stuff, an autoimmune diet with the potential of something like a SCD or a GAPS or a low FODMAP may even be added on, kind of like a filter. You kind of add an additional filter on that camera or a different lens on that camera to make it more superior, more intense based on what the patient needs. But I can't tell you how many times we found things that we would never even have thought to begin with. So we start there and then we add things back in slowly. Now, it's my belief that things like grains should not be a staple just because of their nutrient density. All right. And I shouldn't even say it's a belief. It's actually a fact. Grains are pretty nutrient poor if you look at their nutrient levels. And then when you take into account that they have mineral blockers and protein disruptors like chymotrypsin, trypsin inhibitors, oxalates, phytates, remember, these plants don't want to be eaten. They want to pass on their DNA just like human beings do. So they secrete toxins to make it so if the person that eats it may not want to do so long term. So because of that, we want to be choosing foods that we can digest and eat and still have the nutrient density. So my saying with patients is pretty simple. Sub your grains for greens. Sub your grains for greens, meaning anytime you were to eat a whole bunch of grains in your diet, eat greens instead. And if we want to have a little bit more carbs because you need more carbs because it fits you better metabolically, then we can add some yucca, or we can add some sweet potato, or we can add some plantains, or we can add some pumpkin or some squash. That's a good starting point. And if you want something that gives you the pasta feel, we can do like a miracle noodle or a zucchini noodle or a sweet potato noodle, so you still have that mouth feel and you don't feel like you're missing out.
Yep. Yep, that's well said. Yeah, I did some white rice the other day. I didn't feel good with it, so I'm back on plantain kick, and I'm feeling amazing with it.
Yeah, I actually went and had sushi last night. I love sushi. I primarily do sashimi, and I actually show up there with my own MCT oil and coconut aminos, and I mix that up. That's kind of my, my so-called soy sauce. Now they have tamari there, which is a gluten-free soy sauce, but tamari still got a whole bunch of soy, and which is a phytoestrogen, so I'm not a big fan of that. So we chose, my wife and I did the MCT and the coconut aminos. Now I did do a nice roll. I did like 2 nice rolls, and again, imitation crab or imitation lobster is commonly loaded with gluten. Be mindful of that. And a lot of times they coat gluten and stuff on there. So anytime you go to a restaurant, this is advice that I've used over the last decade, you tell them you have celiac disease. You say, I'm celiac, I have a severe allergy to gluten. You let them know, and they come back and they really kind of comb over everything for you. If you just tell them, hey, please avoid gluten, or hey, I'm gluten sensitive, people don't quite know what that means. So hey, I have celiac disease. I have a severe gluten allergy. Because what does that mean to the waitress or the restaurant owner? It means if I feed this person this food, they're going to start choking, and that's bad for business. They're going to start, grabbing their throat. They're going to need an EpiPen. They're going to get shipped off to the ER. We're going to have an ambulance pull up to the restaurant. So you want to insinuate that by letting them know severe allergy. Now they go back, and they're very careful at what they give you.
Yep.
Like
I've heard
go ahead.
I've heard multiple people say that. So what do you do logistically? You bring the bottles in your wife's purse of your aminos?
Yeah, I just literally brought them. I just had a nice little baggie, and I just brought it in there, and with my wife's purse, exactly just like that.
It's really not that hard. I bring Himalayan salt packets in too.
Yeah. It was easy. I just brought it in, and it was great, and I feel good afterwards. I get really good fats in my body, which is excellent, and I just feel a lot better.
How do you know if you're getting imitation meat at those places? Do you ask them? How does that work?
Yeah, you ask. And the place I went to,
imitation crab?
Yeah, I ask and say, is it imitation crab or imitation lobster? Now, on the menu, it said imitation crab, imitation lobster. So I knew off the bat.
What is that?
It's typically like gluten. It's gluten combined with some other types of things. Because think about it. Gluten is glue. So they can stick gluten to other types of proteins.
Is it fish? I mean, what in the world are they using?
Maybe fish. It may be like a pea or a legume kind of thing. And they combine it in it to make it feel like crab or feel like lobster.
That's so gross.
Yeah, I'll pull it up here and I'll let you know exactly what they bind it to. But again, what does it mean? It just means there's gluten in it.
Yeah, a lot of people ask me that. I think it's a common question. I know we're kind of just freestyling this episode here. People ask about, well, if I'm trying to do AIP, can I ever go out to restaurants again? And I would say the answer is yes, but it's just you just have to choose carefully where you go.
So basically what it is, it's the fake crab or the fake lobster. They just take other kinds of fish and they kind of mush it together and they use gluten to hold it together. It's kind of like a binder, if you will. No, you totally can. People tell me this all the time and I'm like, it's nonsense. I'm sorry. It's absolutely nonsense. I went out to eat last night. All I would have had to have done was just not had the rolls, and the rolls just had a little bit of white rice in it. But everything else was super clean. It had like eel, or I had tuna, or I had salmon, and it had like avocado and like some carrot and some lettuce. The only thing was a little bit of white rice. But worst off, I would just go and get the sashimi. I would just do sashimi. I would just do a seaweed salad or a regular salad and make sure the dressing is clean. I'll just typically use the coconut aminos and the MCT for the dressing. So I'll just say, please, no dressing. And I'll do MCT, coconut aminos, a little bit of sea salt on there, and then you're good to go. If you go into a steak restaurant, really simple. Order a nice clean steak and just say, hey, I have a severe gluten allergy. I want to make sure the spices that are on the steak are just sea salt or just, spices that contain no filler, no MSG. And any nice restaurant's going to have that. Even the Outback had that too. They have like really good like spices that are certified gluten-free. So worst off, you just say, hey, just sea salt. That's it. And you're good. And then you can always do your vegetables. And if you don't like butter, if you can't do butter, you can always bring a little thing with you. Or if you don't want to do that because it's too high maintenance, just do olive oil. Have them put some high quality olive oil, have them just steam it, and have them just bring the olive oil to the table and you dress it.
Well, you could bring that too if you wanted.
Yeah.
You could bring some olive oil.
Yeah, most restaurants will have it though, so you don't have to. And then worst off for like dressing, you can always just ask for a lime or a lemon and then some olive oil and just squeeze that lemon on there and then just pour some olive oil, add a little sea salt, and you're good to go.
I'm on an avocado oil kick lately.
It's great. It's a little expensive, but it's great.
It is expensive.
Yeah, I'm a huge fan. Like I do all my dressings either with avocado or olive oil, and I'll just do a little olive oil. I try to stay away from balsamic because it's a little higher in sugar and mycotoxins, which is like a fungus. And I'll mix that with some olive oil, and I'll do a tablespoon of high quality organic German mustard, and then I blend it up in my Vitamix, and it's good to go.
Yeah,
that's my style dressing.
It doesn't have to feel so sacrificing. I think it's a mindset thing.
Totally,
you just have to hack it a little bit.
Totally
you
is.
Be a food hacker.
Meat, right? Steak. Great, awesome. You can go to a place that has salad and get a really good Cobb salad. There's a restaurant across from me called Maudie's where I live in Austin, and we'll just go and I'll get the fajita and green salad, and I'll ask for extra meat. I'll say no fajitas chips on it, and I'll say 100% certified gluten-free, so they know not to use different tongs or use the same grill that may have had something that had gluten on it before, and they keep it really clean. And then it's just got vegetables, and it's got a whole bunch of meat and some salad in it, and that's it. It's good to go.
That's excellent.
Yeah, so there's a lot of good options that you can do. Just speak up, and remember, like, you're the customer. You know what you want. You want to feel good afterwards. That's the goal. It's not about you want to be a pain in the butt. You want to feel good, and you just got to know what makes you feel good. That's it. If you know what your kryptonite is, Superman's not going to choose to be around kryptonite just because he makes you feel better. You want to choose to be around and say, screw it. I'm gonna do what makes me feel the best.
Yep.
So outside of that, we talked about some of the testing stuff. Now, like Cyrex Labs has some testing that you can do as well.
It's pricey.
Yeah, it's a little pricey, and I only do that kind of testing. I think it's Array Panel 3.
Yeah.
I'll do that testing with some patients only if they're just absolutely, for the most part, not willing to make any diet changes. Now, most people that are finding us have already read and heard our content, so they're already very motivated to make these diet changes, and most of them have already done it. So we kind of help people already because our content's so ubiquitous. The next is some of our stool testing we do with the DRG and the GI map comes with gliadin antibodies. And I see a lot of patients that come back with gliadin antibodies in the stool. And they may not even be symptomatic from a digestive perspective. I had one patient on Friday that had a whole bunch of mood issues and joint pain, and they had the gliadin in their stool.
So what is that telling you? That they're getting exposed to gluten?
They're getting exposed, or they've been clean for a few months, but their immune system is so jacked up from that previous exposure that it's taking that long for it to drop. That's kind of scary, right?
It is. Well, that's why I've heard that. I think I can't remember if that was Dr. Ford or who it was that told me about that. The 6-month number is stuck in my head. I believe that's what he said. That was how long he's a pediatric gastro. That's how long his pediatric patients took, was 6 months away from gluten to get that immune system reset.
There's a famous study out there that looks at thyroid patients, thyroid antibodies being elevated up to 6 months after gluten exposure. So I think that's where some of that came from.
Oh, okay.
It just came from that piece. And again, there's claims out there like the gluten sensitivity isn't real, and then any reactions that people have may be from FODMAPs. And FODMAPs are like these fermentable carbohydrates, fermentable fructo-oligo, disaccharide, monosaccharide, and polyols. And these are certain sugars that can be in foods. I mean, onions are really high, garlic's really high, avocados moderate, sweet potatoes moderate. So sometimes people can be reacting to these higher FODMAP foods.
And not actually a gluten exposure.
Yeah, and it's tough, right? It's really hard to figure that out. So we start with an autoimmune diet, and I tell patients to be FODMAP conscious because FODMAP symptoms tend to be more immediate because it's the gas that arises from the bacteria in your gut eating the fermentable carbohydrate. So you eat, let's say, some onions, the bacteria in your gut, after a certain amount of hours, is going to start producing methane or hydrogen-based gases that will create either bloating or flatulence or gas or indigestion, and you'll tend to know more frequently. again, the problem is I've seen patients cut out gluten, still have other higher FODMAP foods like cruciferous vegetables or broccoli or onion, and their symptoms are gone, even though they're still consuming high FODMAP food. So that's kind of where I call BS on it, is I've just seen too many patients that cut it out but still have FODMAPs feel better. And that's where the clinical experience is really important, because we dealt with so many thousands of patients. We just go back to our database, of what makes sense based on our clinical experience, and that may be the case or it may not be the case. But we have examples of it on both sides.
Yep. Also, I've seen on the GI map some of the elevated, what was it? It's the one near the bottom.
Probably lactoferrin or elastase.
Yeah, the elastase. I've seen that one.
Yeah, typically we'll see it low. We'll see it like, we'll see it low, which means the enzyme level is low, meaning the amount of enzymes the person's putting out is lower. So if you're not putting out enough enzymes, that means the foods you eat, you don't break them down fully. The better chance of them not being broken down, meaning the more fermentation and the more gas and bloating and symptoms can arise because of it.
Oh, never mind. I was thinking of the secretory IgA, that one being high, and then the anti-gliadin secretory IgA too. Those two top ones there on the bottom. That's the one I was thinking about.
Yes.
Okay.
100%. So IgA will get elevated as an immune response. That's the first line defense for our immune system. So when we see IgA elevated, it's like the army sending out the infantry to kind of start the attack, so to speak. Now, most people that when they're chronically stressed adrenally because of all kinds of diet and lifestyle issues, their IgA will be lower. So it's analogous to leaving your front door open and unlocked at night.
Yep.
Anyone can just walk in. So IgA, having good IgA levels are important. Stress, adrenal issues, and chronic food allergen exposure can really weaken your immune system for sure.
Yep.
Via the leaky gut.
Yep.
Just like leaving a light on. If your immune system is chronically hyper-responsive, it's extra energy being allocated towards something that shouldn't be there. If you leave some water running in your bathroom, your guest bathroom that you're never in, and then you leave a light on in that bedroom too, and you're magically the next month your electric bill and your water bill are much higher, even though you didn't notice that because you were, that room was all closed off, right?
Yeah.
That's kind of what happens with gluten sensitivity. You're following the food pyramid. You're eating your 10 to 12 servings of grains a day, and you're thinking you're doing yourself a good deed, but you're really turning on the lights and running the water, and you don't even know it.
Absolutely. Good analogy.
Yeah. So regarding that piece, don't fall prey with a lot of people saying that, hey, just because you didn't react to gluten, it may not be an issue. There are tests out there that you can do, but you can also reintroduce it very carefully and see how you respond. And obviously gluten-free grains first. And those may be okay from time to time. It should never be a staple. And I would try to never do gluten unless it's really a special occasion and you can handle it and you have no diagnosed autoimmune conditions.
Yep.
That's kind of my rule of thumbs. And just the big take home is this: you can ignore reality, but you cannot ignore the consequences of reality. Know your body, know what you can handle, make sure you're really healthy before you even get to that level of exposure. I'd much rather see someone cheat with gluten-free food, like a white rice-based dessert or something, versus a whole bunch of wheat.
Yep. Definitely.
So any other comments so far?
I don't think so. I think we've kind of gone to a couple different places and gotten the point across, I believe, which is be careful, don't be paranoid, but be careful, be wise, be questionable. But you don't have to create a scene. You can still get what you need at restaurants and not be problematic. Like today we went to a local place where I got a bison burger with some greens, and it was excellent. And I feel so good from it. Avocado on it. Oh, man. I'm still feeling good.
Yeah, excellent.
So it's possible. You don't have to. It's not as big of a sacrifice as it may seem. I guess would be my last message.
I'm gonna just read one last research study. This came from a Chris Kresser blog. It was really good on gluten sensitivity, but I'll just kind of reference it here. New study took place over at the Columbia University, and what they did was they enrolled 80 subjects who had self-reported non-celiac wheat sensitivity. So they reported that they were sensitive to it. They ate it. They didn't feel good. 40 with celiac, and then 40 healthy subjects. So 40 were celiac, 40 were just sensitive. And then what they did was they excluded certain diagnostic markers. So like they had IgA, they had transglutaminase 2, histology. They took blood samples on all of the patients and even intestinal biopsies. The blood samples were used to look at signaling molecule proteins in the blood, which is really interesting. Now, what they found was that the non-celiac wheat-sensitive individuals had leaky gut. So they had this gastrointestinal permeability. Now, they compared it to the healthy subjects, and they did not, since this is not really surprising, but they found out that the gliadin component of gluten can affect the tight junctions even in the healthy patients as well. So what does that mean? It means the main mechanism of action is the leaky gut. So it's like just because you leave your front door open for one night and no one comes in your house doesn't necessarily mean that you're compromising your house, your gut, your immune system in this analogy in the long term. So if you do it every day and you leave that door open every day, your chance of getting robbed goes higher and higher and higher.
Yeah, so you could feel well eating gluten, but you're still going to be causing intestinal permeability, therefore allowing toxins and parasites and other things to get into the system that should not be allowed entry.
Yes. So the whole moral of the study was just because you didn't have celiac and you had this non-celiac, meaning you didn't have all the diagnostic markers, the villus atrophy, all of the transglutaminase antibodies, but you still were sensitive. The reason why was the leaky gut. The more you keep that gut open, the bigger chance of inflammation. And that's the thing. It really comes down to immune activation. The more your immune system is activated, the worse. And what they also found was that these people in the non-gluten sensitivity group had higher levels of LPS, or lipopolysaccharide binding protein. This was elevated, and that in itself can increase leaky gut as well. And these are sensitive markers for gut bacteria moving in the gut. So basically, you have gut bacteria from the gut moving into the bloodstream. That's like the vagabonds on the street, the criminals on the street, moving into your house. And when they're in your house, they're setting up shop, right? They're not respecting your stuff. They're creating a whole mess. And that's what these bacteria and these LPS and these bacterial junk are doing in your bloodstream, and they're causing the immune system to activate. So it's like having someone in your house that's like the sheriff and then just start shooting at the people that come in. The problem is there's going to be a whole lot of collateral damage, and the walls are going to be shot out, and a whole bunch of other things are going to be shot out too. And that's like your immune system attacking the thyroid or attacking other kinds of tissue in the body.
Yes, there you go. That was a good analogy.
Yeah. Anything else you want to add to that, Evan?
I don't think so. I think we've got the point across today.
Cool. And then what would you say the best action points are? I'd say steak restaurants, sashimi, grass-fed burger places. Just sub the bun. Just put the burger on a salad. Really good things like Epic bars are great. Jerky's great. If you can handle like the nuts and spice kind bar, if you can handle the nuts, those are great. They're high protein, lower in carbs. Jerky. I would say smoked salmon at Whole Foods are really good, like snacks on the go. And a really good collagen protein shake is great as well.
Yep, I agree. The only thing I would add, I don't know if I would add anything. No, I thought I had something in mind. I don't.
So again,
I like
ahead.
butter. I like butter.
I like butter too, man. That's why I named my dog Butter. But moral of the story is this, right? There are going to be some people that have already tried this and they're not getting better. And there are going to be some people that have tried it and are feeling a lot better. So my kind of plug is for people that are trying it and aren't quite getting all the way better, there's something deeper, and there could be some serious digestive distress. You're not breaking down food. There could be some infections. There could be some serious dysbiosis or SIBO, and we may have to have a clinician's eye really look over it and see what else is going on. And there also may be a lot of malabsorption from this happening for a long period of time too that needs to be assessed and looked at.
Totally. But here's the free step. So take the free step first and then reach out. Go to Justin's site, justinhealth.com. I believe you're booked out like 2 months now. I'm booked out like a month now. So we're still available. We still block out a few hours each month for free consults. So if you're kind of out there thinking, well, can I get help? Can I possibly get better? Generally, the answer is yes, as long as you're motivated to try to make the changes that are necessary.
Yeah, and we keep a few after-hour consults available for people that need to get in on an emergency basis. So if people need that, they can get to the front of the line, not have to wait the 1 to 2 months, because we know some people really need to get in, and people that are less emergent, they can always just get in 1 to 2 months.
Totally. Yeah. So it's good that option's there, because the last thing we want you to do is think that you are going, not necessarily, it's not that you're not going to get help, but we don't want you to go to emergency room and say, look, my gut's hurting. And then you go and you get the endoscopy and then you pick up an antibiotic resistant bacteria, but the endoscopy shows nothing because it's something else. It's not something that's pathological enough that's going to get detected or diagnosed by them. So,
yeah, and the worst thing in conventional medicine is once they see you have gluten, they'll have you come off it and then retest it. And the only problem is if you're really sensitive, you may feel like crap for weeks or months afterwards. That's the problem. Because if you know already, do you really want to, play around with fire like that?
No,
it may not be the best. Yeah, it is. I mean, I see patients that are really sensitive where if they get exposed to it, they literally can be disabled.
Yep, I know.
Not good. So, well, everyone listening, feel free and click below. Give us a review. We love your feedback. We love the word being spread. And if you want, just check out Evan's site, my site. Get more educated. Inform yourself. Get wicked smart so you can take your health back in your control.
Well said. Take care.
Evan, have an awesome Labor Day weekend, man.
You too. See ya.
Thanks. Bye.
Bye.
Got a question for Dr. J? Go to BeyondWellnessRadio.com and click the questions button. Then tune in to hear the answer. Also, if you like the show, click below to review us on iTunes. For more Beyond Wellness Radio, go to BeyondWellnessRadio.com.